But you increased the amitriptyline.
Yes.
And that pushed you over the edge, didn't it?
I don't think so.
The doctor's so uncomfortable in that moment. That's like a mic drop moment for the defense, right? This is where they're really saying, doctor, you didn't know what you're doing. Then you look at the doctor's demeanor on the stand. She doesn't look confident. She looks like, oh, maybe I did mess up here. All that is terrible, absolutely horrific for the prosecution. But prosecutors get an opportunity to try to rehabilitate the witness or at least clarify the issue. So let's take a look now at the redirect of Dr. Tufts on this very issue, which is a huge issue for the defense. Let's watch.
You were asked by defense counsel about the amitriptyline that you prescribed on January 16th, 2023. That initial prescription was for 10 milligrams, correct?
Yes.
Pulling the bottle from exhibit 155 of amitriptyline. Would you agree with me that this shows that the prescription was filled on that same day, January 16th, 2023?
Yes.
And out of this pill bottle here, there were 30 pills in this prescription, correct?
Yes.
And there are eight pills missing from this bottle. So filled on January 16th, 17th, 18th, 19th, 20th, 21st, 22nd, 23rd would be 8 days, correct?
Mm-hmm.
And on the 23rd is when you said she could raise it to 20 milligrams?
Yes.
So if there are only 8 pills missing, she never took that additional dose, correct?
That's what I would think based on what you just said.
So the amitriptyline, increasing it from 10 milligrams to 20 milligrams, wouldn't have pushed her over the edge, correct?
Well, if she didn't take 20 milligrams, then that's correct.
But it increased the endotrip. Yes, that pushed her over the edge, didn't it? I don't think so. That exchange lasted 11 seconds. 11 seconds inside a Massachusetts courtroom where a doctor was asked to defend the single medical decision she made the day before 3 children were killed. The answer was not confident. The answer was not clinical. The answer was a hedge wrapped in doubt. And that doubt now sits at the center of one of the most legally consequential murder trials in modern American history, because the question is no longer whether Lindsay Clancy took the lives of her children. The question is whether the medical system loaded the weapon and handed it to her.
But you increased the amitriptyline.
Yes.
And that pushed you over the edge, didn't it?
I don't think so.
So Jennifer Tufts was treating Lindsay Clancy the day before Lindsay strangled her 3 young children to death and then exited a second-floor window of their home, leaving herself paralyzed from the waist down. Now Lindsay is on trial for triple murder, but is pointing the finger at her mental illness and Dr. Tufts. Meanwhile, Lindsay's now ex-husband, the father of the 3 children, also believes Lindsay is not criminally responsible for killing their children.
That was really where her big spiral started. She started to lose a lot of weight, and she became very depressed, and she was having a really hard time. Yeah, she started to say she was suicidal.
It's the trial that the nation is watching, a case that has divided the community as to what should happen to Lindsay Clancy. Should she go to prison or should she be put in a mental health facility?
I discussed with her and her husband the possibility of potentially an underlying bipolar disorder.
And today, more compelling testimony connected to the weeks, days, and hours before the horrific killings as a jury tries to figure out why Lindsay Clancy did it. Lindsay Clancy was absolutely seeking help, but one of the issues in this case is what was her condition? What was her actual mental illness? And was the treatment helping her or making it worse? I'm Vinny Politan. Let's investigate. I want to begin not by speaking about Lindsay Clancy, but speaking about her former husband, Patrick, the victim's father. And his role in all of this is really quite unique because on the one hand, immediately after all this happened, he forgave his...
Think of it like this. You are watching a pilot in a cockpit. Warning lights are flashing. The co-pilot is pointing at the fuel gauge, but the pilot keeps pushing the throttle forward because the manual says the aircraft can handle the stress. That is what the defense is asking this jury to believe, that Lindsay Clancy was not an evil actor, but a malfunctioning aircraft. And the people who were supposed to maintain her kept adding the wrong kind of fuel.
His wife at the time and asked the world to forgive her. So clearly he doesn't believe that this is a criminal case that should have been brought. He believes that this is a case involving prosecutors going after someone with mental illness, his former wife. But something else has happened here now with Patrick Clancy, is this level of internet skepticism towards him. Not that he's not a victim in all this, but he's the actual killer. Like he's being accused of framing his wife for this on the internet for many reasons, including his shoes. But when we get back to what's happening inside the courtroom, not what's happening online and all that chatter, I mean, both sides agree here that Lindsay Clancy is the one who is responsible for taking the lives of those 3 children. What they don't agree on is why she did it. Was it just like evil, or is she the victim? And when I say the victim, what the defense is talking about is being a victim of mental illness, a victim of improper treatment, a victim of the wrong medications, which made her condition even worse. So that's what this jury has to figure out. Is she evil, or is she the victim? And one of the issues that the defense has brought up is bipolar disorder. And they have claimed in this trial that she was misdiagnosed or undiagnosed as being bipolar and was given medicine that is the exact opposite of how you would treat someone with bipolar. Medicine that would make it even worse. So as you watch this testimony, this section becomes very important. This is one of the nurse practitioners who treated Lindsay Clancy. Her name is Rebecca Gelada. And in this part of her testimony, she's talking about bipolar. She's talking about Patrick. She's talking about Lindsay. Let's take a listen.
When you met with Lindsay and Patrick on December 6th,
Before we go deeper into what the actual medical records show, make sure you are subscribed to the VerdictOrigin, because we do not just cover the story. We follow the evidence, and the evidence here does not move in straight lines. The most important document, in this case, is not a murder weapon. It is a prescription pad. December 7, 2022, Rebecca Gelada, a nurse practitioner, sends Lindsay Clancy a message through the patient portal. She writes that she is concerned about an underlying mood and bipolar disorder. She sends a list of symptoms. She tells Lindsay to hold the Prozac. She says the words mixed manic state.
did she or did they report why Patrick was there?
I don't recall if they indicated why he was there. I understood it to mean he was there to provide collateral and support for her.
Were you aware that he was coming to the appointment?
I don't recall if I was aware beforehand or not.
And you had engaged in a pretty significant my chart back and forth with her in the days preceding this this meeting on December 6th, right?
Yes.
Did she ever indicate to you in those messages that she wished to bring him along to one of the visits?
No.
Fair to say, when a person brings a collateral and is willing to have somebody speak, you're more than happy to get that information.
Absolutely.
This person, this collateral person, can they offer you a different perspective about the patient and what they're going through or what they're, how they're presenting?
Yes.
In this December 6th meeting, or the visit, did she report to you some changes in her sleep or significant concern for sleep?
I would have to review the note. What I remember is that the sleep really hadn't improved much beyond getting a few hours, waking up in the middle of the night, maybe piecing together.
Okay.
More time.
And fair to say there was some conversation to go back and talk about when symptoms started and try to get to kind of the root cause or what they believe the root cause of her symptoms were.
Yes.
And did Lindsay and Patrick report to you the connection with the Zoloft medication in September as a concern?
Yes.
And that at that they reported that, or she reported that exact night,
That is a warning sign that would stop most prescribers in their tracks. But Lindsay and her husband Patrick did not agree with the bipolar theory. Patrick's exact words were, "My wife is not bipolar." Lindsay said nothing.
Went from 25 to 50 milligrams. I didn't sleep for 48 hours and I wasn't tired.
Correct.
So that's in your note as a quote, meaning that's directly what she told you?
Yes.
Okay. Did you express to Ms. Clancy thoughts that you had about her diagnosis based on your interactions over the last few weeks?
I did.
And what was that?
I discussed with her and her husband the possibility of potentially an underlying bipolar disorder. I based this on several factors, one of them being that she had such what we call an activating response to the Zoloft. It's unusual for somebody to describe taking Zoloft and then going 48 hours without sleep and not being tired. So that raised my clinical suspicion a bit. And she had been, I would say, having difficulty tolerating other antidepressant medications that we had been trying to have her take since then. And so again, I'm wondering if it's because potentially there might be an underlying, what we call mood disorder, bipolar disorder.
And as far as the information that you had about her past psychiatric history, were there any indicators to you about manic episodes?
No. So I do recall in reviewing Julie's note prior to meeting with Lindsay, she filled out what we call a mood disorder questionnaire. It's like a screener somebody can do to assess history of mania and bipolar disorder. Lindsay had, it was a negative screen. So there's 3 questions. One question has 13 different symptoms. You have to score 7.
So the prescriber listened to the patient and the husband. She went along with the request. That is the documented record. A clinical suspicion was raised, a family pushed back, and the system bent.
Out of 13 on question 1, but also in question 2, it asks about, are the symptoms happening at the same period of time? And then it asks about any functional impairment from the symptoms. So I recall the 3 symptoms she did endorse were not sleeping for that period of time with the Zoloft and not feeling tired, having racing thoughts, and trouble concentrating. None of the other symptoms did she endorse. They did occur at the same period of time. And I don't want to be inaccurate, so I can't remember what she said for functional impairment, but I believe it was minor impairment.
When you explain this to them, your thoughts about her reactions to the medication and these reported prior symptoms, did Patrick and Lindsay seem receptive to your diagnosis?
I recall Patrick saying my wife is not bipolar. Lindsay looked at me. She did not say anything.
What did Lindsay Clancy express to you as far as Seroquel? Did she want to continue with that?
No.
Did she explain why?
So she felt like when she took Remeron and Seroquel together, she felt weighed down and exhausted, but her mind was still awake and alert, and she just didn't seem to think there was a benefit to being on it.
And so did she express to you a desire to want to go back to trialing Prozac?
Both Lindsay and her husband expressed that that was their preference.
And was that something that you agreed with?
I did. I had shared with them that I had concern this could be bipolar. It's in my differential diagnosis, which is just all the typical diagnoses we might be considering. And that typically SSRIs are contraindicated, but she did have that history of being able to tolerate Prozac at 20 milligrams. And
Now follow the prescription chain. Zoloft, then Ativan, then hydroxyzine, then buspirone, then trazodone, then Seroquel, then Valium, then Prozac, then amitriptyline. 17 appointments in 4 months, 14 with Dr. Jennifer Tuss, 3 with nurse practitioner Rebecca Gelada, multiple emergency department contacts, a partial hospitalization program that discharged her after 1 day.
So on December 7th at 9:48 a.m., she sends a message saying, "Hi, Rebecca, last night did not go well at all. I took the Valium and melatonin and only slept from 9 to 1. Then around 2, I got desperate and took 25 milligrams of Benadryl and only slept about 1 more hour. What can I do? I really need help." So that was the message that you came into on December 7th, right?
yes,
And did you respond to her in the messaging app?
I did.
And what was the response?
I'm trying to find the sequence.
Yeah, 10:19 a.m.
I think it's cut off. Okay, so I discussed, I mentioned, so your husband made a good point yesterday. Despite taking the Ativan in the evening, you were still only able to get a 5-hour stretch of sleep, which, yes, is improvement, but does sort of dispel the notion that benzodiazepines are the only thing that are helping you sleep right now, as you are still getting less than the target of 6 to 8 hours with Ativan, and the Valium did not help for sleep much at all. My next step in this case is to try a higher dose of Seroquel on its own. Are you feeling any subsequent loss of energy, exhaustion, fatigue with lack of sleep?
Why would it be the next step to increase from 75 of Seroquel to 100?
So she had been taking 50, so I was suggesting 75 to 100 would be my next step, because again, bipolar is still on my differentials, and now I have the data that she only slept 2 hours. So I asked her the follow-up question, are you feeling tired? Or, are you feeling exhausted? Any subsequent loss of energy? It's still in the back of my mind that this could be bipolar.
So as far as the Seroquel goes at that point, creeping up the dosage, do you get now from the using it to treat insomnia to using it to treat something else like bipolar?
Correct.
And so that piece...
The defense has one word for this: over-medicated, and the medical record does not refute it. It confirms a rotating cocktail of drugs with no single physician taking full command of the case. The phrase "no single captain" applies here. No single captain. But here is where the narrative splits. The defense says the amitriptyline was increased the day before the killings. January 23, 2023. Docker. Tuss raises the dose from 10 milligrams to 20 milligrams. The defense attorney leans forward and says that pushed her over the edge. The prosecutor then does something quietly devastating. They hold up the pill bottle. 30 pills prescribed on January 16. 8 pills missing. That is 8 days of medication. The increased dose was never consumed. So, the prosecution argues the drug could not have caused the psychotic break because the drug never entered her system at that higher level. The bottle becomes the evidence, no single captain.
Correct.
And then the next day you wrote a script for, December 6th, you wrote a script for diazepam 5 milligrams, right?
Correct.
December 7th, you wrote a script for diazepam 5 milligrams, right?
Correct.
December 7th, again, you wrote a script for quietapine, 30 count, right?
I would need to check my...
You can look at anything you want. If
Okay.
you have your records, feel free, please.
Okay. You said
Yeah, it would be December 7th. I'm looking at quietapine, 30 count, 100 milligrams.
I don't believe it was a 30 count of 100 milligrams.
Do you remember writing quietapine script for 100 milligrams?
I do. I believe the quantity was 22.
22, okay. So on December 7th of 22, you wrote a script for quietapine, and forgive me, I'm sorry, what is that again?
Seroquel.
Seroquel, for 100 milligrams, right?
Yes.
And why did you write the script on November 30th for quietapine 25 milligrams and then about a week later increase it to 100 milligrams?
On November 30th, I had anticipated utilizing it over a 4-week course of treatment for sleep and anxiety, but her clinical symptoms, presentations changed, and we opted to use it for mood stabilization.
And who's we?
Me.
Okay. And were you working with anybody else, any psychiatrists or anybody?
No.
So when a person comes to your clinic as a...
That does not end the question. It deepens it. Because if the increased dose did not push her over the edge, then what did? Was it the accumulated effect of months of psychiatric whiplash? Was it the untreated and unrecognized bipolar disorder that Gelada flagged but could not force anyone to treat? Or was it something else entirely? The husband, Patrick Clancy, forgave his wife immediately. He asked the world to forgive her. But then the internet turned on him, his shoes, his timeline, his tone. People began asking whether he was not merely a grieving father, but something more. The court has not accused him of anything, but the public record of his decisions is now part of the trial narrative. He said he did not want to waste a day in the emergency department. That is not an allegation. That is a quote from the medical record.
Piece of it about feeling a subsequent loss of energy and exhaustion, fatigue. Why ask that?
Patients can have insomnia because they're anxious or because they're depressed, but typically they're exhausted or they're tired the next day, and it really does affect them. If a patient has an underlying bipolar, they could go on 2 hours of sleep and not feel tired at all, and that's unusual.
And so that is one of the signs, potentially, of a manic episode?
Potentially, yes.
So on December 7th at 10:33, she responds, no, the weird thing is I don't feel tired at all. And she says, so just Seroquel tonight, ? I feel like I'm going to panic without a benzo with it. And then again at 11:44, another message, would I be able to do the Valium with Seroquel? Is that a safe option? So again, in this exchange with her in my chart, she's asking you questions to clarify what you've said and also alternatives to address the issue, right?
Right.
And as far as her questions go, and then her response about not feeling tired, how did you respond in the message?
So she kind of sent those in succession. So the I don't feel tired, would I be able to do the Valium with the Seroquel? So I respond by, if you're not sleeping well with the Valium alone, there's no need to continue it, and I will prescribe a short taper to get you off benzos altogether. because you are not tired at all and had a significant reaction to Zoloft at 50 milligrams, I'm concerned this is an underlying mood and bipolar disorder. I know you and your husband did not necessarily agree with that, but I feel that I'm going to send along this information to review. So I sent her a list of symptoms of bipolar, risk factors, so that she could have it to refer to.
And again, at this point, the only symptom she was reporting of mania was this not being able to sleep and not feeling tired, right?
And yes, and the racing thoughts. And
Here is the ticking clock question you need to sit with. If every single provider who touched Lindsay Clancy in those 4 months had 1 extra hour to coordinate her care, 1 hour to compare notes, 1 hour to see the full picture, would those 3 children still be alive? That is not a rhetorical question. That is the entire case compressed into a single pressure point. Because the system did not fail once, it failed in sequence. Each prescription was a rational decision in isolation and a compounding catastrophe in combination. The medical term for that is polypharmacy. The plain English translation is too many hands on the wheel.
they inform this has been the worst day for Lindsay, is having persistent intrusive thoughts of suicide, no active plan. But both Lindsay and Patrick agree that higher level of care may be necessary at this time. Discussed options, they state they are likely to go to MGH ED, as they have perinatal psychiatry as well as an inpatient psychiatric unit. Lindsay also deciding about McLean. This writer advised that they keep us posted and sign a ROI, release of information, so that we can communicate with treatment providers at higher level of care. Lindsay verbalized understanding and agreement.
On December 16th at 12:50, that she, after visiting the ER yesterday, I opted to remain outpatient and pursue the partial program at Women and Infants. And Women and Infants, that had been the program that you had previously recommended in Rhode Island, correct?
Correct.
She indicates, I'm waiting on a call back for them to schedule. In the meantime, I want to know how to proceed with my meds. Do you still recommend the 2 milligrams of Valium and 200 of Seroquel nightly? Again, it's making me sleep well, but still not improving my mood. So I will need a refill on those meds. Please let me know.
I said, hi, Lindsay. I know Letitia may have called you yesterday about information about women and infants, so I hope you were able to connect with her. Target dose for Seroquel treating depression is 300 milligrams, so we can increase it to 300 milligrams. If you are willing, yes, continue the Valium. Let me know what you think.
In her messages later in the day at approximately 2:11 p.m., she indicates, I spoke with my original psychiatrist after my ER visit, and she recommended adding 25 milligrams of Lamictal to stabilize my mood. Is that something you would agree with? Had you ever talked with her about Lamictal before?
No.
Is it a drug that you kind of commonly recommend for people?
I do.
And was it something that you thought could be a good fit for this patient?
Yes.
Okay, but as far as now what you know to be the medications that she's been advised to take, what are they at this point, December 16th?
Lamotrigine, 25 milligrams, Seroquel, 300 milligrams, and Valium, 2 milligrams.
And still the moral refrain returns. No single captain. It appears in Gelada's testimony when she admits she worked alone.
In the time frame of October, or the end of September, October, November, December, and then January, 4 months.
Yes.
And that's 14 times plus the 3 that she saw you. Is that right?
Yes.
So that's 17 times that this young lady had access to healthcare providers for her mental health issues, correct?
Correct.
And that would be within a compressed period of time. I know it's the last week, I believe, in September, but October, November, December, and then January, right?
Yes.
And during that period of time, you're aware that she was provided many, many, many prescriptions for antipsychotics, selective serotonin reuptake inhibitors, benzodiazepines, all of that, right?
I'm aware she was prescribed other medications.
She was what?
Prescribed other medications.
Did you ask what other medications there were?
Yes.
And did she tell you?
Yes.
Did she tell you who prescribed them?
Yes.
It's pretty easy to get a list from CVS, right?
Yes.
And did you have any difficulty determining who was providing the prescriptions for all of these medications?
No.
And did you know that, in fact, it was Jennifer Tufts that prescribed the sertraline, September 15th of 2022, 30 count, 25 milligrams, was Jennifer Tufts. You knew that?
I did.
You know that Jennifer Tufts on October 21st, 7 count of lorazepam. You know that?
I did.
And 5 days later, Jennifer Tufts prescribed on October 26th hydroxyzine, 25 milligrams with a 30 count. Did you know that?
I did not know that.
Did you know that on the same day, Tufts prescribed 30 count of lorazepam? Did you know that?
I would have known that, yes.
It appears in the cross-examination of Dr. Tuss when she cannot say how many other prescribers were involved.
Paper.
As far as the perinatal behavioral health clinic at South Shore, you're aware that on December 30th, Patrick Clancy called in about his wife.
Correct.
And that he spoke to a nurse, Katrina Melanson.
Yes.
And the record reflects that he reported that she was safe, right? But she'd like to go to McLean.
I do recall that.
Okay. And he was advised to take her directly to the emergency department. You can't just go there to McLean, right?
Right.
In your experience.
In my experience.
And that he said he didn't want to waste a day in the ED. Is that your recollection of the record?
That is my recollection of the record.
And that he was looking just to get the bed that was offered the last time on December 15th.
Yes.
And it's fair to say that that's not how the process works?
They do not hold beds for that length of time.
Okay. And so then he was advised to take her to the emergency department or call 911?
Correct.
And was that the last contact that the South Shore Perinatal Behavioral Health Clinic had with Lindsay Clancy?
Yes.
And she goes to McLean. She gets out in a few days, and then Nurse Gelada's not treating her anymore. So her treatment ends. But what's significant about her treatment, again, is this discussion about what exactly is going on with her. What is she really suffering from? Are we getting it right? And all of that plays right into the hands of the defense. All right, so let's get into the cross-examination now of Rebecca Gelada, the nurse practitioner who treated Lindsay Clancy. Her direct, I thought, was kind of helpful for the defense. So let's see how much further the defense takes some of this testimony and takes some of the observations and analysis that's being done by Nurse Gelada.
Did you talk to Tufts?
No.
Did you ever get access to Tufts' medical records?
No.
Do you know how many times she saw Dr. Tufts?
I do not.
Would it surprise you if I told you that she saw Dr. Tufts 14 times?
No single captain. The phrase echoes 3 times. Once in Gelada's testimony, once in the cross-examination of Dr. Tuss, once in the discharge records that sent Lindsay home after a single day. Now you have to make a judgment, not about guilt or innocence, that is for the jury, but about the gap between what the system documented and what it actually did. The documents are public. The Massachusetts trial exhibits are accessible through the court docket. Look for Exhibit 155, the pill bottle. Count the pills yourself. Then read the MyChart messages between Lindsay Clancy and Rebecca Gelada on December 7. Ask yourself one question. If the warnings were already in writing months before the tragedy, why did the system wait until a courtroom to take them seriously? Tell me in the comments what you find. If this kind of evidence-based breakdown matters to you, like, share, subscribe to the VerdictOrigin, and turn on notifications. Because when the system buries its mistakes, we pull the public record back into the light.